Welcome back to Patient Win Insider. I'm Nick Moen, and today I'm joined by Dr. Richard Stevenson, founder of Stevenson Dental Solutions and former UCLA chair of restorative dentistry. So here's a big question I want to cover today. Are dental schools preparing students to actually practice dentistry or just graduate? And that being said, Dr. Stevenson has taught thousands of clinicians and built one of the top hands-on training centers in the country and continues to mentor the next generation of dentists worldwide. So today we're talking about what's broken in dental education, what excellence really looks like, and how to thrive in a profession that's changing fast. Yeah, I'm kind of overarching. I want to cover that question of what happens, leaving school, and what does it look like for, a newly practicing dentist. But you've been in dentistry for 4 decades now?
Correct.
Well, thanks for coming on. And I'd love to know, when did teaching and mentoring become part of your mission?
Oh gosh, thanks, Nick. It's a lot of good topics to discuss. When I graduated from UCLA School of Dentistry in 1986, I went into private practice right away. And that's what the lion's share of graduates did back then. They actually started their own practice. Very few of them went on to continuing specialty training or AEGD or GPR residencies. They just went into practice. And I loved my practice. My dental assistant saw this ad in the California Dental Association journal for a part-time faculty at UCLA. And I said, hey, maybe I should give that a try. And she says, oh, doc, you'd be great. You really love it. So because I was seeing patients 3 to 4 days a week, I thought I could spend maybe a day up at UCLA. And I went up there 1 day a week. I loved it. Within 2 years, I got voted Teacher of the Year at UCLA, even though I was a part-time faculty. And the rest is history. I ended up selling my practice to my partner, who was also one of my classmates at UCLA. And then I left for academia, and where I could see patients, teach, and do research, sort of the ideal trifecta, if you will, for anybody that has that particular interest. And that started my career off in education. And I'm still there today.
Yeah. Well, and what about your own practice? The Stevenson Dental Solutions, like how did that come about, and what inspired you to take the leap in building your own center?
Okay, great. Yeah. So after 26 years at UCLA as a faculty member, 17 of which I had a big job of being the chairman of restorative dentistry. I mean, I got to experience a lot of incredible students and technologies, et cetera. We always had to stay on the cutting edge, but at the same time, be a little bit reluctant to jump in without having good evidence. So it gave me a really good grounded sense of how to approach education and how to, teach our future clinicians. When I decided to leave UCLA in 2018, I wanted to take what I had learned. And remember, I'd never stopped seeing patients. We had a faculty practice. I was very, very active in the care of patients, not only with residents, but also my own private patients. I wanted to duplicate that in my own, but I wanted to be the boss and not have to rely on administration or the restraints that are sometimes imposed on faculty due to financial things, and have my own thing going. So that's what I did. I went all in. I kind of took my retirement earnings, and I put them into this particular center. And we have grown. We're now about a 4,200 square foot center with 3 dental operatories and all the latest technology, plus a very large teaching facility. We even have a research facility within our building. So we're doing everything I did at UCLA, but I am now the dean, if you will, of my particular educational center.
Yeah, well, it's nice to take that leap. I know that academia can sometimes impose some restrictions, and I mean, ultimately, it might not be the place to practice and learn the procedures, right? I mean, I've heard that new grads coming out sometimes aren't ready to fully perform common restorative procedures, right?
This is absolutely true. We've always suspected that there has been a gradual, insidious decrease in the amount of time the students spent doing a lot of the procedures we did back in the 1970s and 80s and before. There was this shift of emphasis in the mid 1900s. I say 1900s. It was last century, 1990s. God, it makes me feel old. But we kind of were a little bit on the defensive mode of trying to defend our position as as teaching surgeons because an independent report from the Institute of Medicine in Washington, D.C. basically stated that dentistry was at a crossroads and that we were spending way too much time teaching technical skills and should be teaching more critical thinking and more things that were being taught in medical education at the time. And the American Dental Association and all the deans of all the dental schools took this report very seriously. It was such a long report, they actually made a book out of it. And I read the book several times and I said, I'm a little nervous about this because none of these people writing these reports are actually dentists that treated patients. They were public health professionals and PhDs and theory and all kinds of things like this. And I kind of held my opinion to myself a little bit, but what I witnessed was definite shift from excellence to competency. And maybe it needed to be done. It was a good thing. I don't know for sure. But I did see the lack of emphasis on clinical and laboratory procedures. Most dental schools now no longer have in-house laboratories that would work with the students. The students don't have to do their own lab work. I had to do my own lab work on every case I did. Yeah. Now they have no idea what that is. It all gets outsourced. A lot of those decisions were based on financial, but they were also based on, hey, look at this report. This report says we spend too much time teaching technical skills. But there's a major difference between medical school and dental school. And here it is. When you complete 4 years of medical school, you're now just starting your true training. You're just starting. You don't have surgical skills. You sometimes don't even know what you want to be yet. So that's why you have postgraduate educational experiences to help you to become a surgeon. Dentistry is different. Remember, DDS, the S in DDS means surgeon. So at the end of, it actually means surgery, right? Doctor of Dental Surgery. So at the end of 4 years, it's incumbent on the educators to produce a surgeon capable of seeing patients of a broad range of skill set and be able to perform these procedures not only competently, but in my opinion, strive for excellence in everything they do. A recent publication that is going to be very controversial in the education ranks was just published in the Journal of Operative Dentistry, looking at recent graduates that had gone into postdoctoral programs for general dentistry. And they surveyed the dental students that had just graduated, and they also surveyed the supervisors, the mentors in those graduate programs. And what they found was shocking. And the shocking realization that was really put forth really beautifully in this particular peer-reviewed, highly respected paper is that dental students are not fully prepared to treat patients without mentorship in their early years of graduation. And that is mind-boggling. And the thing that's kind of scary is that the students' perception of their own abilities was completely different than the objective masters that were teaching them. So there is a huge disconnect between what you think you know and what you really do know. And for that reason, I think that postdoctoral educational programs like ours are essential. And we're not the only one, but I think that, there are not a lot of places like this where truly you spend most of your time doing hands-on things. A lot of courses claim hands-on, but it's about 80% lecture. And then you do one little project at the end, where when you come into our center and other centers like ours, and there's not a lot, but you'll start by within 30 minutes, you're already working with your hands. And we expect our students or dentists that come here to learn a lot of the didactic information ahead of time. We'll provide them with uploaded PowerPoints for them to review before the course starts and after the course starts, so that we have this kind of ongoing communication before, during, and after the course when it comes to intellectual information and then skills development information. So and I can tell you that it's really something people appreciate because they feel like, my gosh, I never got this. And that's a scary place to be, to think that your actual school that educated you for all this money and all these years hasn't really prepared you to enter into private practice in a highly competent manner, even in a competent manner. So I was in that system and I saw it happening, and it was very difficult to fight the forces because there's a huge push to put things in the brains of the dental students. If you can think it, you can do it. And that's just simply not true. I can't get in front of a piano, and if I can think about a piece, I can't play it. I have to spend significant time practicing. So I think that that is kind of at the core of the current problem that we're facing in dentistry.
So, I mean, if you were to redesign dental education from scratch, what would it look like? Where would you start?
Well, I think, that's a great question. And I think I have to applaud the deans and the leadership in the dental schools for doing the best they can. I think the faculty, some of the most amazing faculty in the world in any educational system are in dentistry because they actually have to show that they can do it in addition to talk about it. And, that's not really present in other types of programs. So I think that we've got a lot of good resources, but I think that the emphasis perhaps should be changed from minimal competency to maybe maximal competency, or even let's talk about excellence. I remember when we were dental students, if we asked, is it good enough, the instructor would become quite upset with us and say, what do you mean, is it good enough? What you should be thinking about is how great can it become, not just how minimally acceptable it can become. So I think that the dental schools have probably got to team up together and reevaluate some of the culture, some of the curriculum, and maybe start to emphasize a little bit more skills development. And I don't mean to rework it and go back 50 years or 40 years. That's not what I'm talking about. Let's use what we know today to leverage that into a skills development system. Perhaps having postdoctoral education become a requirement of getting a dental degree that they do in many other countries. I know if you go to dental school in India, you finish your dental school and then you mandatory 1-year externship or internship. And so things like that could be considered. And I think that the American Dental Association would support that. I think we have enough resources to make that happen. What a beautiful way to transition into practice, to have that year where you get buffered and can be proven. You can, kind of a proof of concept. Do I know what I think I know? And if I don't, can I get some help? I think that might be a really great initial recommendation at this point, because major curriculum changes are slow, costly. They're fraught with a lot of political, pushback. And so I think that something like what I just described could in fact be better, with a recommendation also that students understand, hey, you got your DDS, but it's just the beginning. We value this term lifelong learning. Well, what does that really mean? And I think a lot of people think lifelong learning just simply means taking your 25 hours of continuing education per year. But, probably it means a different thing. Probably it means something more, a more tailored journey through dental education, postdoctoral education that would involve hands-on courses, that would involve fundamental courses. Fundamental courses seem to be incredibly powerful for the people that take them, but a lot of people don't think they need them. And once again, I look back at that paper. We don't have always a very good know yourself situation when it comes to dental skills. One of the things that I learned how good or bad I was as a dentist by joining a study club. And for 22 years, one day a month for 22 years straight, over 170 procedures I did in front of a mentor. Photographed, documented, and critiqued live at the end of each session in front of my peers. I did that for 22 years. Most dental students that graduate today have never experienced that, not even for one session. So you just imagine the difference in what you would learn if you had that level of continuing learning with your skills versus not. So I think we're in a situation where we have some opportunities in dental education for sure. And then we also have to be really careful about what courses we sign up for when we graduate. You got to be really careful. One of the things that, and it does sound like a promotion, but I can't help promoting ourselves because I just know that we're just, our course evaluations are skyrocket, they're 9.8 out of 10 usually, or even higher. And I know people really like it, but recent graduates get all of our courses at half price, which is unbelievable. And dental students can take our courses for 1/10 the price. So we have a huge reach into the new graduate and even the dental student for our coursework.
And what type of clinicians are coming to you for training?
Well, I think our average clinician is about 14 years in practice. And it surprised me because I thought it was younger, but actually it's a little bit more experienced. And I think that they found some failures and they're frustrated. And maybe the education they received is now finally starting to come back in the way of failures. Failures take a while to percolate. And so once you get you get into a practice, you work for someone else, or you're working for corporate or whatever you're doing, you're doing your thing, and then you'll get those emergency early failures. But a lot of times your failures may take 5 or 10 years to come back, and you're like, uh-oh, what I thought I knew, I didn't really know. And so a lot of disillusionment and a lot of concern. So the kind of people we get are usually somewhere between 10 and 20 years out of school. And they typically are people that have come to terms with the fact that, hey, I'm okay being humble. I'm okay with being told I need to kind of refresh, and I'm going to give this another try. We'll even get some master clinicians take our courses because they want to see, is there anything I'm missing? I really think I got most of it, but let me just see if Stevenson has something to add. And they love the courses too. So you may have a recent graduate or even a dental student in one of our courses, all the way to somebody that's got more experience than I have.
Yeah. And they're striving for excellence, right? And obviously attempting mastery,
Yeah, yeah. And
So what are
yeah, go ahead.
well, I mean, what so and maybe this is hidden secrets, but what are like one or two key habits that you are fundamental in training that you're teaching at your practice?
I think that probably one of the great things that we get people to do is to look at things more critically, understanding what the high standards are, taking photography, reflecting back on what they're doing with photographic interpretation of what they're doing. Once you see things, you can't unsee things. So once you see you've left a finish line or a margin in a J-shaped form, which would break off in the future. Once you see that you've underprepared something, once you see that you've got a rough wall that will be a problem for restoration, once you see a problem with occlusion that you didn't recognize before, you can't unsee that. And so, knowledge brings a lot of kind of this uncovering, this discovering of where you're lacking. And it's kind of just a mindset. I mean, I don't think, for me, excellence is a journey. And mastery is kind of an attitude of how I can become consistently better. Can I look at my work and reflect on what I could have done in a better way? So oftentimes what we'll do is you'll analyze, and then you'll analyze during the procedure, and then you'll have digital capture of the information, and then you'll be able to analyze that. And, so there's another level for you to make notes on. And it's simply, you don't have to put too much pressure on yourself because it's sort of a daily practice. And rather than trying to run a marathon once every year, why don't you just walk around the neighborhood every day? So it's a slow and steady approach rather than an intense, only do this once every seldomly do. So I think, mastery is a cool thing because you can define your goals yourself, and your goal can always be changing. And you can just say, look, I'm not perfect. I am just trying my best. But what I do know is that I'm a little bit better than I was a week ago.
Yeah.
And if I can just kind of keep doing that, I can probably achieve a life that I can look back on and go, hey, I led a good life as a dentist. I really tried my hardest. And the other thing that we like to really mention a lot in the course is intention. So before you see a patient, say a little, I tell people either, say a little prayer to yourself, or say a saying to yourself, or spend a moment, meditate. Just say something like this: today, I'm going to do the best dentistry I can possibly do on this patient. And so when they enter the room and they trust their care to me, I'm going to do the best that I possibly can, rather than just say, oh, another patient routine, another patient, whatever. Yeah, whatever. And so it's interesting how if we just can have ourselves focused before each patient that way, it's amazing how much more fun it gets and how much better we can ultimately do. So that's kind of cool too. So that, it doesn't matter where you are on the spectrum of mastery. It doesn't matter,
Right.
because it's a self-defined pathway.
And what about the set? Does the setting help? I mean, you're in your operatory now, and I mean, having with the way technology's developed in the past couple decades, I mean, how much does that play into, the how effective the education is?
I think it's a huge part. I do think that, I've got microscopes and I have 4 different scanners. I just bought a 5th one. I have a milling machine. I have 2 printers. I have a robotic implant machine. I have 2 CBCTs. I've got all the wonderful printers and toys and digital workflows, cameras. All of this stuff is all great, but you need to see, listen to the technology teach you. Don't blame the technology for problems, but see where the technology is exposing a potential weakness that you can maybe improve upon. And I think it's amazing. I love it. I think the technology is phenomenal for this. But sometimes we get into a situation where we're like, hey, it's us against the technology. Or if there's a problem, oh, it's the technology. Where in fact, I think we can look at the technology and all of the visual feedback, 3-dimensional feedback we get, and we can make it a learning process for our continuous improvement.
And do you have a favorite piece of technology, a new toy that you want to talk about?
Wow. Oh my gosh. I think maybe it would be my photogrammetry approach towards capturing implant impressions. I love that because of the precision. And I also love scanners. I have many of them. So they're all do different things. So I think scanning is essential. But also, I love the fact that I have a milling machine and I can mill my patients' temporary crowns. We don't make temporary crowns by the old technique. We actually scan and mill the temporary crown for patients to walk out with a beautiful temporary that almost is too good for them to want to return for the final restorations when we're not doing in-house crowns. So I think for larger cases, we like to sort of have a lab involved in the process, and we don't like to do all those cases in-house. And we'll make them a nice either printed or milled provisional, and those are great. So for me, that is super fun. Also, I must mention we have a Yomi robot for implant placement, and the precision that we're able to place implants relative to the design software is amazing. So whatever you design is what you're going to place.
Wow.
And doing robotic implant surgery it's pretty fun. I mean, it's pretty amazing compared to the other technologies that we used to employ, like
In
GART.
2025, I have to ask about AI. Like, how is AI? I mean, you see it assisting, you
Well,
see that influencing where things
yeah.
are going.
Well, the number one use I have for AI for me personally is to take my crazy thoughts and make them into a cohesive point I'm trying to make. So for me, that's really the most valuable. But there's also AI everywhere. We have AI quick designs that come back with AI designs for implant temporary crowns, for printed restorations. We have AI. We use Overjet AI for looking at caries, periodontal bone loss. So you can, if I find that to be really mostly helpful for patients to buy into what you're talking about. So I think it's going to continue to evolve. I would love AI to be able to track every single patient and tell me when their next visit should be based on their healing, rather than us having to look through software management and things like that. I would love that to be a possibility. I've spoken to the leaders at Overjet AI, and they said they're on it. They're on it. So that would be great. I mean, if you place an implant in January, this program would actually be able to email the patient and put it on the book that you're going to go ahead and evaluate for final impression at this day, sometime in April or something. But if there was a bone graft involved, maybe it takes a little longer, and it would be able to know that and stay on top of it, and every day give you a, hey, good morning, you have these 4 implant patients that need to be called or brought in. I've sent them text messages, please follow up. I mean, wow. Because implant dentistry is so complex in terms of just managing the various stages that you're involved in. It's kind of like being a contractor where you're building 1,000 homes and they're all in different levels of development, and to know how to order supplies to deal with these 20 that need this phase and these 10 that need this phase. And it's pretty complex. So that would be a wonderful AI evolution I think for all dentists.
Yeah. Well, it's exciting to, potentially play a role in that too. I guess, I have an earworm. But is that, I mean, having kind of that influence through education, is that what keeps you excited about dentistry after 40 years?
I think so. And also it's partly that. I mean, I love being involved I love it when my opinion matters. That's incredible. And that I can humbly suggest things to companies that are interested in evolving. that to me is fantastic. I'm a KOL for I don't know how many companies, 20 or something. And for me, it's not what they can do for me. It's what we can do together for dentistry at large. It really is, because I made that point in my dental journey where it's less about income generation and that type of growth, which is very important for the early career person is debt elimination and skills development. And then the mid career is growth. You got to grow so you can shoot for some day where you don't have to work so hard. In my situation, I'm working for fun. This is my joy in my life. I love being part of this. I find this to be the greatest time of my entire journey in dentistry seems to be now.
So do you feel, I mean, is this success? Did you reach it?
Oh, when I got accepted in dental school, that was success. I look back and I go, oh my God, I was so lucky. I wasn't as bright as 95% of the kids that are getting into dental school today. They're so smart. They're so smart. But I think, success can be measured many different ways. For me, it's not so much a benchmark or I have to have this amount or something or this amount of students or this amount of square footage of a teaching center. Every day is a journey in success. Where just connecting with a staff member that was a little bit bummed out about something, educating somebody on something, listening to somebody tell their story about how they're having trouble with their family at the moment. That's a success too, just being a human and being okay with our fallibility, and I think we're just, looking at those things as being successful benchmarks. Thankfully, being reasonably healthy for my age is I look back and go, wow, I probably shouldn't be this healthy, but that has been incredible mark of success. So then you can stick around and continue having the fun that
Yeah.
you're having.
Yeah. Okay. I love that. Well, I've one more question. I mean, looking back at everything you've done, and I mean, a lot of wisdom there. Do you have like an idea of what sort of legacy you want to leave?
I it would be great if the legacy I could leave would be that everyone can find their journey of mastery and can make that happen. And it doesn't just have to happen for a few people. Everyone can do it. It doesn't mean you're going to be a teacher of other dentists. It could be that you're just a teacher of your patients or of your staff. It could be that you just have inner satisfaction from having been better along the way. We're all different and we have different definitions of that. But if the legacy could be that you too can be a master, would be a legacy that I would really feel great leaving behind, because the definition of that can be tailored to exactly what it is that you want to achieve.
Yeah, well, that's inspiring. Hey, Dr. Stevenson, thanks so much for chatting with me today. It's been,
It's
yeah,
been great.
inspiring.
Been great, Nick. My pleasure. Yeah. And if anyone's listening, please, I'm sure, Nick, you're going to leave contact information and stuff like that. I'm a strange person. I really actually welcome text messages, emails, phone calls. I give out my cell number to every person who takes a course from us. And I mean that because I think as a community, we need to stay connected. And if you spent the time to reach out to me, I need to spend the time to reach back out to you.
Yeah, I love that. Well, do you want to plug the website one more time, and then we'll add
Sure. I
the
mean,
contact?
it's I have a YouTube channel. I got 180,000 subscribers. It's just called Stevenson Dental Solutions, and then we have a website, typical Stevenson Dental Solutions. We have a whole ton of courses. I'd like to say if you're within 5 years of graduation, you get half off. If you're in dental school, you get 1/10. You basically 90% off. If you are after that, you can still obtain discount. If you're a member of the Academy of General Dentistry, we give 20% discounts. And if you take multiple courses, you get discounts too. So everybody's on a budget and courses are not cheap. So we just wanted to make sure we had plenty of ways to do that. We also have an airway training program that is amazing. This is such an emerging area of dentistry. So dentists that want to do less, drilling and less kind of an anesthetic and things like that can find a life as an airway restorative dentist, an airway dentist, and do things a little bit differently. So we have courses in that too. So we're trying to be as complete as we possibly can. We're running a course right now, in fact. So I took a break from the course, and yeah, I would love to hear from you. So please reach out.
All right. Thanks for sharing, Dr. Stevenson. It was a pleasure having you on.
Great to be on, Nick. Thanks so much.